Good morning. My name is Scott Elder. I'm Vice President, General Counsel for Electromedical Products International, EPI. I want to thank you for the opportunity to speak with the panel today. Our presentation will focus on the Alpha-Stim CES device, which is the device manufactured by EPI. In addition to our PowerPoint presentation, EPI has provided this panel with a point-by-point response to the 2011 proposed rule and a brief response to the proposed questions and executive summary FDA provided to us just 48 hours ago. Additionally, we've provided you numerous documentation prior to the meeting that you should all have. Dr. Kirsch and I will be giving the presentation today on behalf of EPI, but as you see, we have a larger team with us, all of whom are prepared to answer any questions you may have. Francine Nichols, who is listed as one of our panel members and helped prepare a large portion of the scientific evidence for this presentation, has had some health issues and is unable to join us today. We'd like to begin this presentation with a brief overview of Alpha-Stim. Alpha-Stim is a CES device which has been on the market in the United States since the 1980s. It is cleared to market by the FDA through the 510(k) process for the indications of anxiety, insomnia, and depression. U.S. sales are limited to by or on the order of a licensed healthcare practitioner. Elsewhere in the world, Alpha-Stim is sold over the counter and has Class II device status in Europe and Canada. An estimated 8.25 million treatments were administered over the last 5 years. Currently, our largest customer is the United States government and state governments, followed by China and Europe. As you can see in this slide, EPI's government orders have increased dramatically over the past 5 years. Currently, EPI sells over 1,000 devices per quarter to the U.S. government, and our U.S. military market grew 57% in the past year, helping establish the effectiveness of the device. The U.S. military's use of CES is primarily for anxiety, insomnia, depression, and PTSD. This graph also highlights a continual growth in utilization of Alpha-Stim CES with service members for those primary indications. This chart provides numbers which were graphed for you in the prior slide, again highlighting a continual increase in utilization of Alpha-Stim CES over the past 5 years by the U.S. Department of Defense for the treatment of depression, insomnia, anxiety, and PTSD, which FDA acknowledges in its executive summary is a form of anxiety. In 2010, the Pain Management Task Force of the Office of the Surgeon General for the U.S. Army listed CES as a Tier 2 modality in its standard of care protocols, highlighting the acceptance of CES within the U.S. Department of Defense. 3 colonels who were a part of the task force were users and prescribers of CES, and they were instrumental in CES's inclusion within the guidelines. So how does one now use CES? I'm now going to play for you, if I can do this, a video that this is
dual connector end of ear clip wires into channel 1 or channel 2 jack. Remove old ear clip electrode pads if present. Attach 4 new ear clip electrode pads. Saturate the ear clip electrode pads thoroughly with several drops of alpha conducting solution while they are on the ear clip electrodes. Power on. Set frequency to ½ Hz. Set timer. 20 minutes is usually enough time if the current is set to at least 250 microamperes. 40 minutes to an hour or more is recommended if the current is at or below 200 microamperes. Squeeze ear clips open and apply one to each earlobe. Increase the current slowly until a dizzy feeling is experienced, like rocking on a boat. Then decrease it immediately until the dizziness stops. Also decrease it if the normal tapping sensation felt on the earlobes becomes uncomfortable. For people who have a history of experiencing vertigo, which means dizziness, such as motion sickness, treat at a current setting of 100 microamperes for 1 hour or more to prevent residual vertigo after treatment. Relax, sit or lie down, and let the Alpha-Stim M relax you. You may also read, work at a desk, or watch television. Do not attempt to drive or operate dangerous tools or machinery during treatment. Always complete a cranial electrotherapy stimulation session. When the timed session ends, if a heavy feeling is still experienced, resume treatment until at least 2 minutes after the heaviness lifts and a light feeling develops. Cranial electrotherapy stimulation may be used as often as necessary, but for most people, it is best to treat between once a day and twice a week.
Just hit that little thing right there.
Thank you very much. That was a brief video taken from our training video that's provided to all of our patients upon the purchase of a Alpha-Stim CES device. It's a 30-minute training video. CES has had a long history with the FDA, as this has been on the market since the 1960s in the United States. As a pre-amendment device, CES was placed in Class 3 until FDA could determine its proper classification. Since the 1970s, all legally cleared CES devices have been cleared through the 510K process of substantial equivalency. A CES is not life-supporting or life-sustaining, and evidence exists to determine that special controls would provide a reasonable assurance of safety and effectiveness. Therefore, CES does not fit within the Class 3 classification. EPI has filed 5 separate 510K applications, 1 PMA, and 2 petitions for reclassification with FDA, all highlighting the safety and effectiveness of the device. In August of 2011, FDA proposed a requirement that CES devices would go through a pre-market approval process, and API submitted this petition for reclassification. During our petition for reclassification, we submitted new information respecting the device, and based upon what the FDA indicated earlier through the reclassification process, it's this new information that we would like you to consider today. EPI is here today to ask that this panel review the research and data provided to determine if there is a reasonable assurance of safety and effectiveness with CES, and if sufficient information exists to establish special controls so that CES can be downclassified to Class 2. Class 2 devices are subject to special controls, which include performance standards, post-market surveillance, and patient registries. EPI will show today that it has sufficient special controls in place to allow for downclassification. There are certain factors that are considered when determining the safety and effectiveness of a device. Factor 1 is the persons for whom the device is intended. The target population for whom CES was intended is defined within the federal regulations as those patients with anxiety, insomnia, and depression. The target population has been served by CES since the late 1970s. Factor 2 are the conditions for use and labeling of the device. Alpha-Stim CES has been labeled and used for anxiety, insomnia, and depression since the 1980s. Factor 3 is the probable benefit weighed against the risk of injury from use. Alpha-Stim CES has a very good risk-reward ratio, which is consistent across all research. Factor 4 is the reliability of the device. EPI has 31 years of research, data, and inspection reports confirming the device's safety and reliability. I'd like to also point out that we're compliant with ISO 13485 standards. The reviewer of a reclassification petition is to rely upon valid scientific evidence to determine whether there is a reasonable assurance of safety and effectiveness. Valid scientific evidence includes well-controlled investigations, partially controlled studies, studies and trials without matched controls, case histories by qualified experts, and reports of significant human experience. Given our time limitations today, EPI is focusing on Alpha-Stim double-blind RCT studies. EPI has also provided FDA additional studies that meet the definition of valid scientific evidence, and copies of these submissions have been provided to this panel. EPI is in a unique position where it comes to you today with 31 years of data establishing the safety of Alpha-Stim CES. The reality is that, unlike FDA's proposed rule, which discussed potential risk to health, the safety data provided to this panel today will establish how safe Alpha-Stim CES truly is. There's virtually no risk with the device, as we will show that with 8.25 million treatments over the past 5 years, there were 15 consumer complaints, all of which were minor and self-limiting. There is a reasonable assurance of effectiveness when it can be determined that in a significant portion of the target population, use of the device will provide clinically significant results. EPI has an abundance of well-controlled investigations amassed over 31 years of encouraging research by independent government and university investigators in the form of mechanistic studies like fMRI, Loretta, EEG, EMG, and other diagnostic tests, double-blind randomly controlled trials, and other less rigid models. This research is also supported by post-market surveillance and comprehensive, scientifically valid user surveys. You will note several comparisons in this presentation to RTMS. EPI felt it was appropriate to use RTMS as a comparison because it was the most recent device FDA has classified as a Class 2 device, and RTMS is used as a treatment for depression. We agree with FDA that a comparison of CS to RTMS is valid. EPI has self-imposed special controls for nearly 2 decades, which compare closely to the special controls recently adopted by FDA for RTMS. EPI is compliant with FDA, European, Canadian, and Chinese regulatory agencies, and many other regulatory agencies worldwide. Alpha-Stim CES is again classified as a Class 2 device in Europe and Canada. This panel is charged today with the task of determining whether the evidence submitted and available is valid scientific evidence for determining the safety and effectiveness of CES. The valid scientific evidence, when taken as a whole, should provide adequate support for a determination that there is a reasonable assurance of safety and effectiveness. EPI believes the data provided today and in 2009 and 2011 submissions, when taken as a whole, provides more than a reasonable assurance that Alpha-Stim CES is safe and effective for the conditions of use of anxiety, insomnia, and depression.